Everybody, today I'm going to talk to you about adherence therapy and how it can affect medication compliance in patients with schizophrenia. Medication non-adherence is a major problem in the severely and chronically mentally ill. It's estimated that 1.1% of the United States population suffers from schizophrenia. That's from the National Institute of Mental Health. Symptom burden of schizophrenia, symptom severity can lead to self-care deficits, homelessness, inability to perform ADLs, and a lack of awareness that the person may actually need an antipsychotic. It creates a really difficult cycle to break for these people. Some of the main reasons someone may be non-compliant with their antipsychotic regimen is obviously side effects, cost of medications. They may be homeless, have a lack of resources to obtain those medications as well. As you might guess, medication non-adherence leads to increased hospital admissions and readmissions. In 2012, there were 383,000 inpatient hospitalizations related to schizophrenia complications. It's estimated that 15.4 to 22.4% of those patients were readmitted after their initial admission within 30 days for a complication related to schizophrenia. So this really shows that we do need effective interventions to improve compliance. The question we're going to talk about today is, in adults diagnosed with schizophrenia, how does adherence therapy combined with routine care compared to routine care alone affect adherence within 18 months? Adherence therapy is a special kind of therapy that has been proven to increase medication compliance among adults with schizophrenia when it's combined with treatment as usual, meaning in a usual therapy they may do their usual medication regimen. Adherence therapy is effective in boosting adherence. There is supporting research for this question. Shin et al. In 2016 conducted a randomized controlled trial among 134 adults with schizophrenia. They assigned them to either an adherence therapy plus treatment as usual group or a treatment as usual only group. And they measured several different variables, one of which was compliance. They included medication compliance, severity of symptoms, insight into illness or need for treatment, level of functioning, number and length of hospitalizations in a 4-month period. The patients who received adherence therapy in addition to treatment as usual had better overall outcomes in all of those areas than the patients who received only their usual treatment. This shows us it's really important for consistent follow-up for patients with schizophrenia, continuity of adherence therapy if it's initiated while they are in an inpatient setting, and shows that it's really important for the patient to be involved in their plan of care. Adherence therapy is an effective adjunct therapy for schizophrenia based on the results of this study. Another study found to support this intervention, Dykek and Kutlu, 2016. They conducted a controlled trial with a quasi-experimental design. They evaluated outcomes of adherence therapy plus treatment as usual versus treatment as usual alone in a group of 30 schizophrenic patients. This was a little different from the first trial because they evaluated outcomes with pre and post tests and measured outcomes that differed slightly but still included medication adherence. The other outcomes they measured were internalized stigma of mental illness and cognitive insight. The results indicated a significant difference in the level of medication adherence in the adherence therapy and treatment as usual group versus the treatment as usual alone group. So again, it concludes that adherence therapy is effective in improving medication compliance among patients with schizophrenia. There are many things we can do to improve our nursing practice based on these research results. Both studies utilized psychiatric nurses in adherence therapy sessions and found adherence therapy to be very effective in increasing medication compliance. If we implemented adherence therapy for all of our schizophrenic patients, either during the first hospitalization or during the first office visit, it would lead to better outcomes for those people. They would have an increased ability to care for themselves and to function in society, and hopefully an overall number of decreased hospitalizations for relapses, and leading to better healthcare costs overall, obviously. Results can be used by the psychiatric mental health nurse practitioners. They can implement those in a group setting, in an inpatient setting, or an outpatient setting. So it's a really versatile therapy. So the proposed intervention is adherence therapy in addition to treatment as usual, meaning the regular medications that do work for schizophrenia when taken as they're supposed to, should be the standard of care for every patient with schizophrenia who requires antipsychotic medications. As I said before, it can be used in the inpatient or outpatient setting. Some things to remember about the inpatient setting is that if it's implemented during the hospital stay, we need to make sure that the patient has proper follow-up for continued adherence therapy once they're discharged, because it's really important to keep doing that. Could be done in group or individual setting, and it gives the patient more control over their care, more involvement, and so then they have more autonomy that they can hopefully continue. All right, thank you for watching my presentation. I hope you learned something today about adherence therapy for schizophrenia.